So our goal of today's presentation is to provide information about exceptional programs at our hospitals, and today we're going to be focused on the Mental Health Services Program with Providence Care. We've assembled a panel of speakers who, if you'll excuse the play on words with today's Let's Talk announcement, will provide us with more information and get us talking about mental health right here in our community. Our first speaker today is Tracy Davidson, who's the Manager of Community Rehabilitation Services with Providence Care Community Support Services. Tracy holds a Master of Rehabilitation Therapy, a Bachelor of Science in Occupational Therapy, a Bachelor of Education from Queen's University, and a Bachelor of Fine Arts from the University of Waterloo. She must have gone to school for a long time. I knew she was very talented. I had no idea all the training. Prior to 2009, Tracy worked with Correctional Services of Canada at the Regional Treatment Centre of Ontario, and during her time there, she created the first affirmative business in a federal correctional facility in Canada, along with developing mental health training for staff in partnership with the National Community Mental Health Strategy, specializing in fetal alcohol spectrum disorders. In 2002, Tracy was awarded the Queen's Golden Jubilee Medal for her work integrating employment best practices into programs for recovery from mental illness. And just before Tracy comes up, I'd also like to welcome Karen Carmichael, the Administrative Director of Adult Treatment and Rehabilitation Services Program at Providence Care, just to explain briefly how the Let's Talk grant will have an impact in our community. Karen.
Thank you, Denise. First, I wanted to just say thank you to Bell Let's Talk and the University's Foundation, Kingston, for their support in obtaining this grant. This grant's going to make a very big difference in the lives of people we serve. I want to explain a little bit about what it's doing, and then Tracy and Adriana and Leah will give you some really wonderful insights into plans. Providence Care's Community Connections Recovery Program supports clients along their path to recovery and creates opportunities to learn skills and coping strategies for successful community living. One such opportunity is the Hope and Discovery Artisans group, which encourages participation in the arts through workshops, shows, and art sales. Members of the group learn skills that help them promote and sell their products in the community, providing hope, motivation, and opportunities for inclusion. The Bell Let's Talk grant will allow us to increase participation and engage professional artists to work with the artisans. Creative projects developed will be based on the themes of access to health care, community inclusion, and stigma reduction. The resulting work will be showcased during a 10-day public arts festival during Mental Health Awareness Week in October 2013. So when you stop to think about an art exhibit, you realize it's a huge undertaking, and it's going to involve producing invitations, art catalog, catering the opening night, and this provides yet another opportunity. Providence Care has had a long-standing partnership with VOCAC, which is a not-for-profit business that provides employment opportunities for people we serve. Employment's a critical component of recovery for people living with a mental illness. So all of the printing, marketing, advertising, and catering for the Arts Festival will be contracted to VOCAC to provide even more opportunities for people living with a mental illness. I'm going to hand it over to Tracy, Adriana, and Leah. They're going to talk to you about the activities that will flow from the grant, about our Community Connections Recovery Program and the significance of art to recovery, and our partnership with VOCAC and the importance of work in recovery. And finally, relay a personal experience with art.
Thank you, everyone. It is a thrill to be here today. I'm really excited to have this opportunity. Again, as Karen, just to reiterate, Karen, we're going to have a 10-day arts festival with the money that we received from Bell Let's Talk. We're going to have painting, music, drama presentations, and use photo voice to illustrate how we can reduce stigma in our communities. Our goals, of course, are to really improve the well-being of the people that we serve and the people living in our communities with mental health issues. Reducing stigma, self-stigma, the stigma that you have when you've haven't been successful or have had a diagnosis of a mental illness that can, over time, really become a greater burden than the stigma itself. Capacity building, and really showcasing our talents and abilities in our community. We're going to engage professional artists. There are many professional artists in our community that also have the lived experience or have family members who have the lived experience of having a mental illness. Really wonderful artists that we're planning to hold workshops with. We want to increase engagement opportunities for the public and our consumers of mental health services so that we can really, that's how we can reduce stigma over time, by having that face-to-face engagement. We really are also going to increase our abilities to offer community partners to get them to jump in and join us. Because there are many there have been many different arts groups in Kingston that support people with mental illness, and we want to partner with them so that they can take part in the experience also. Our themes, again, as to reiterate what Karen said, are to provide access to health care in a recovery-oriented manner, using recovery models, community inclusion, and let's bust stigma. Our show will take part during Mental Health Week in October 2013. We'll have artwork, live performance photography, and music. This is Community Connections where it's housed. It's on 533 Montreal Street. We're in the community. You may drive by this every day and not really see us, but that's where we're located. And we're right next door to the Community Support Services at 525 Montreal Street. Both programs use a recovery model in the community. This recovery model was developed by Patricia Deegan, and Patricia Deegan was a young woman who was told, once she was diagnosed with schizophrenia, that she would never be able to go to university and become a doctor, and she proved them all wrong. She developed a recovery model. Recovery model is that we are components of many, many different things in our lives, not just the mental illness. We focus on the person in the center of our model, and that way, by supporting by supporting our vulnerabilities and really enabling the strengths, we can do a lot to improve the lives of people living with mental illness. I'm going to pass the mic over to Adriana Farkas. You'll see Community Connections have two occupational therapists. We have Matt Mills on the left, showing some of the portraits that are done in the Artist Cooperative, and Adriana Farkas. Adriana?
In describing the program, I will start with this image of painting that we have done as a group. It's actually our very first collective painting. And then to explain a little bit what do we do at Community Connections and what our values are. This is a statement of purpose of ours. As occupational therapists at Community Connections, our mandate and privilege is to offer support to our clients in their recovery from mental illness. We acknowledge that recovery is a personal journey. We aim at collaboratively finding personalized strategies and supports in order for clients to live well in spite of many limitations that the illness may impose in their lives. We consider and promote the process of engaging in meaningful occupations as a main path towards recovery. We view all our clients as spiritual beings, regardless of religion and or beliefs. We aim at providing opportunities for self-exploration and development and pursuing of personal interests as valued by our clients. We believe in the capacity of all human beings to access inner strength, to be autonomous, and to learn from each experience while connecting to others and contributing to the society. Community Connections. So our program is a community-based, individualized rehabilitation program that serves individuals of all ages in recovery from mental illness. It offers a supportive environment where people can learn skills and coping strategies in order to live well in the community. It provides many opportunities for participating in meaningful activities, and we offer our services to a daily average of 20 individuals coming from community or from the hospital. We are there are the program is organized in a very inviting, home-like fashion. For instance, we have a kitchen, a living room area. There's a small garden in the back of the building that we tend to maintain in the summer. There's these two occupational therapists there. We are always available for support, individual or for group counseling as necessary, to plan and organize activities. There's our recovery-oriented knowledge and values and approach ensures that we focus on the person as a whole and not on the diagnosis. Informal and therapeutic relationships at the program actually are geared towards a personal goal achievement. Socializing is a very big component, and this allows people to maintain or regain a sense of community integration. There are morning activities that are open to everyone coming to our program. There are also afternoon activities that actually address specifically identified needs in the group. And through group interventions, for instance, we have smoking cessation groups, diabetes education, social skills groups, the art-making program. Art has been always seen as a therapeutic tool in recovery, and it's been known to increase access to the community, to bring a sense of competency and control, and to increase self-esteem, to bring hope. But how did we get to come up with this group? How did we get to create Hope and Discovery Artisans? It actually all started with one man that you see in this picture, Brian Prue, a client of our program. He would come to the program and draw and paint day after day by himself, and it was this peace and serenity and satisfaction about him that drew the attention of others who wanted to join him. And then a few clients decided we needed to meet more regularly, and this is how we started to use this space. It was an old woodworking shop that we started to use as our studio. Then what followed was this gracious invitation to enter a partnership with the Limestone School District Board, specifically with the Creative Arts Focus program led by this remarkable teacher who you probably know, Karen Peppercorn. And you can see our partnership here. And this actually opened the doors for us to be in the community, to join them in arts exhibitions, and we're really grateful for that. A literature review was done then, just to ensure that we were on the right track from an evidence-based practice point of view. And it sure enough revealed that art making, and along with leisure activities and positive life events, they all have positive outcomes, and of course they contribute to mental health recovery. And to illustrate this, I will talk just a little bit about one study, one of the most recent studies in the field, done by researchers at the university in Australia. They explored the role of art making in mental health recovery. And in this study, participants from two psychosocial rehabilitation programs offering art-making practices similar to our program, actually, gave in-depth interviews describing their experience with the art-making. And the results of this study are really, really encouraging. Actually, analysis of their description of what art-making means to them and to their life reveal that there are certain qualities that a context inducive to art has. For instance, these feelings of belonging and security and encouragement. So the setting provided this sense of safety, of peace, of relaxation. Then the facilitators were an important factor. So the facilitator guides, yet provides freedom and support in exploring one's artistic abilities. And there was this trust and openness between the facilitator and the members of the group that seemed to be valued by these members. The group actually provided this sense of connectedness. There was this energizing support from its members, that peer support component that is so valuable in mental health recovery. And of course, there was it allowed to a movement away from negative feelings and thoughts. Then some on how art making actually benefits mental health. It was revealed that these participants joined this process, that engaged in art making in order to create a life of balance and wellness. So beyond being productive, they found satisfaction in this intrinsic rewards like inspiration, groundedness. They also, it gave them a reason to get out of bed and be with others and join others in doing something. There was this, it allowed for time away from illness, of course. By releasing tensions through the art process, there was, people gained this sense of empowerment, of confidence, of, there was an increased self-esteem. People discovered they are more resourceful and more independent. Then the personal growth component. If we think of all the challenges, but also rewards that art making involves, people gain this will to achieve and to do better and to keep at it, right? So, and sometimes to move forward in life. And I will let Tracy now speak a little bit more about what this means for us.
So Belle's investment means a lot to the well-being of people living in our community with mental health issues. It encourages occupational engagement, so having something to do with your time that's meaningful. It showcases our abilities and really helps reduce stigma because it's showing what we can do, focusing on what we're able to do. Enhancing skills, so we're going to learn from our professional artists about how to professionally showcase the arts. How do we set up a website of our work? How do we display our work, mat it, frame it? How do we hang it properly in a gallery? It's going to enhance our artistic abilities by showing us how can we work in encaustics, in wax, and how can we do it in a way that's very cost effective. A lot of the artists that we'll choose in the community will be people that we know work really, really well with what they've got. With unlimited resources, a lot of our people to do some amazing art, we can find some little tricks to go right to the farmer to buy the wax rather than going to the art store to buy it. So they'll really enable us to be able to do the work by picking people that are already experts in our community and how to sell their work, so how to professionally sell it. We want to measure our outcomes using photo voice, so by giving cameras to everyone in our group and getting them to go and take photos about social inclusion and access to healthcare in our communities. Let's give them some training about how can I use a camera to really enhance what I'm doing. We're also going to use a very iterative approach, so and a very nothing about us without us, sorry, so that we have a bit of use participatory methods in which they can actually develop the survey themselves to do some of the outcomes, measure some of the outcomes. We're also going to be partnering with our Queen's University community development students, occupational students at Queen's, to look at how can we measure our outcomes in a really effective, meaningful way, so that our artisans can participate.
We have a statement here from the group that I would like to present. As Hope and Discovery Artisans, we have discovered art as a vehicle for our self-expression and self-awareness. Art making allows us to break the walls of self-imposed isolation and marginalization due to mental illness. Participation in art shows enables us to expand our capacity and gives us the opportunity to influence others. The exhibition of our work allows us to reach to our community through art, to grow stronger, strengthening our collective self-concept as a pathway to recovery. We invite this way the community to get to know us through our artwork and to witness the power of art in healing the heart. You can see here our group participating in workshops and shows in the community. I would also like to read a statement from Brian Crew that I already introduced to you. He says, "I like to paint in an impressionistic way. I also like to paint figures. There's an incredible amount of beauty in everyone. I've been at it for about 20 years and there is no sign of slowing down. It's amazing what the public can tell you about your work, how people can read into your painting. I like the feel and the smell of the paint. Passes time. It's hard work mentally, but it's a good feeling when you finish. If only one person likes my work, it makes me happy." Another member of the group, Liana Smith, she says, "Before joining Hope and Discovery Artisans, I had never taken the time to appreciate art. I just assumed that it was something I couldn't do. Now I couldn't imagine my life without it. The movement, the development, and the colors, they all inspire me. It is always a bit of a struggle to begin, but once the paint hits the canvas, I relax and I am filled with such peace. Exploring my creativity has become a rewarding experience. It calms me. I am thankful for all Hope and Discovery Artisans has brought to my life." And another artisan, Hélène Rojo, she says, "Exploring a new medium such as acrylics and painting has enabled me to go beyond my comfort zone of fabric and yarn. Seeking to create warmth, movement, and texture, I hope to engage the observer with each new creation."
Bell Grant, as we mentioned before, will also create some employment opportunities for people in our community. We have Voices, Opportunity and Choices Employment Club have businesses in which they provide employment opportunities for people living with mental illness in our community. So our catalogs, our invitations, posters will all be created by Vocec Print, providing employment opportunities. Catering opening night will be also provided by people living in our communities with mental illness. And we're also going to be supporting entrepreneurship by enabling people to develop their art and sell their art. So this is really, really important because we know that unemployment rates are really high for people living in our communities with mental illness, although they really do want to work and don't have the opportunities. And we know that without mental health, how many people here have been unemployed for a time in their lives in which they felt a little bit down about it? I remember looking for a job, being new to a community, and it really doesn't, you don't feel like jumping out of the bed in the morning and brushing your teeth and structuring your day. It can get fairly depressing, and that was just for a short amount of time that I was unemployed. I couldn't imagine being unemployed for a longer amount of time. And we know that there are all kinds of consequences to being unemployed when you have a mental illness, including increased suicide risk. So there are lots of benefits to employment that are really well expressed in the research, and all of these are really important. I know that it's a motivation to start using my coping strategies. I have coping strategies to deal with some of the voices that I'm hearing with the mental illness. Well, I can start using those coping strategies if I've got a place to go and something that I've got to do during the day. It's a motivation to take medication too. I can now, I've got something that's going to work towards my benefit. Increasing self-esteem, improving quality of life is absolutely number one for employment and finding ways to employ people. Having that sense of purpose and meaning in your life. We know that stigma busting is important to employment, because it changes our perspectives of people. You may go into a cafe, one of our cafes, and you know that coffee with the double milk and the large milk and sandwich is ready for you because that's what you get every morning. So it raises also your own expectations of who you can become. If I've been diagnosed with a mental illness and I haven't had employment, I really didn't know that I could really do this. And now, oh boy, I can do this and I can do more. So you start unlearning those dependencies that you can get, and that self-stigma that can be the biggest barrier if you have a mental illness over time for many, many years. And as Church describes in her research, she does a lot of qualitative research in consumer survivor movement about what people gain from being employed in our communities. So here's Bokek Print, and we're going to make art catalogs, and I like to bring props along with me. So I thought, well, let's choose the best art catalog that I know about, and that's Fountain Gallery in New York City, and they have an art gallery for survivors, consumers of mental health services. So we'll create the catalog, the invitation, the brochures, advertisement, and art cards. So putting the our art on the front of cards, beautiful artwork, which really are they're gorgeous, and be able to sell the cards to support the Hope and Discovery Artisans, and then the artists themselves will get will sell the painting and get the full cost of the painting, and perhaps we will make some cards with their permission. And that's what we're doing right now, and we just hope to expand this. We'll also be partnering with Bokek with their cafes so that we can do the catering. And right now we have a small gallery inside Treasure Cafe at 525 Montreal Street where we sell their artwork. So it's a place that people can actually get their artwork up on the wall and have an opportunity to sell their work. And also sell some of the cards that they're making from their artwork too, to support the program itself. You'll see that on every table you have a small little gift of soap, and there'll be a quote inside that little gift about mental illness from Bell Canada. That's from our new business called Ecoporium, which we're manufacturing, selling eco-friendly products. And you can see Belinda there working on the products. So it's been our experience in the community that we can reduce stigmatizing attitudes by having that contact, that day-to-day contact, in very positive and meaningful ways. And remove those barriers that are artificially created and increase employment and really get people out into the community so they feel so everyone feels included and everyone has valued roles in our communities. It's better for all of us. Now, some of the quotes, we've had all kinds of anecdotal research evidence in our program, but we know it's backed by very strong evidence. And this is a quote from one of our workers. She said, "I no longer shy away from conversations with new people because I know they'll ask me where I work, and that I'll be too ashamed to tell them that I don't." And this attitude changed to, I have a new belief now in my own capabilities. After working in our cafe for a number of years, she said, I looked in the Kingston Week Standard, and there's a job ad there, and I just said, I can apply for that. And she said, I'd never even think that I'd have the ability to do that before. So it went from, it wasn't that, not that I think I can do that, not that I hope I can do that, but I know I can do that now. And that was not something I would have felt before I had an opportunity for employment. Before that, this is an individual who really rarely left her house, and she was in that house for 15 years. So it's huge to watch the recovery benefits of employment. I have the real pleasure now to introduce Leah Murray, and I'm going to read Leah Murray's artist statement. "The strangest of being human is what moves me to paint. I like the unusual, the unexpected, captured in the fluidity of the female face and form. I use acrylic on canvas to investigate the body and its shape and meaning in a kind of half-light or semi-darkness, that particular in-between shade, the one that turns the inside out." And with that, I'd like to present Leah Murray. She has a wonderful book that she's also written. And after this presentation, out where the orchids are in the hall, she'll be selling her book. It's a fabulous read. I couldn't put it down. And it's called Romance of the Buzzard. And you can also see some of her artwork along the front of our display. Okay, for that, I'll pass it on to Leah. Leah?
When I was hospitalized for depression, I remember being nervous and shy about coming into a group of unfamiliar people and not knowing what to expect. But I was happily welcomed by the members and their incredibly friendly instructor, Adriana. And a whole world suddenly opened up for me. I was immediately given a place to display my art. As a member of the Hope and Discovery Artisans, not only was I able to hang my paintings in the Treasure Cafe, I was now given the opportunity to show my work in actual art shows downtown. The first one I entered, called In the Art of the City, is where I made my very first sale, which was very exciting. And I've since sold other paintings, something that would never have been possible had the paintings stayed where I was keeping them before, in my storage closet at home. And more importantly than selling my art, I was given a place where I felt accepted as a human being and as a real artist, not treated as just a mentally ill person who plays with paint strictly for therapy, but first and foremost as a person with genuine artistic talent who creates real works of art. For me, more than anything else, this sense that I'm doing something of value gives me a feeling of purpose and certainly aids in my recovery. And being a member of the Hope and Discovery Artisans offers even more than this. I discussed just what it means to belong to this group with my fellow members, and here are some of the things they said. It gives them a reason to get out of bed in the morning, and by coming regularly, it helps them establish a daily routine. It's something to look forward to, something to give them a break from the problems of everyday life. It allows them to take part in activities that are enjoyable, activities that give them the ability to express themselves and achieve a sense of accomplishment. It offers them a chance to take part in activities they could never have afforded on their own. It gives them the opportunity to socialize and form friendships and feel like they're part of a team rather than stay home and be alone. And it gives them the opportunity to discover that they actually like art, that they are actually creative, talented, productive people with something to offer the world after all. Thank you.
I want to thank Bell Canada for their support. These are some, I brought along some of Leah's paintings so you could see them. This brings people, I think when we talk about with a lot of the people that we work with, one of the major problems that they have in their life is that isolation, about being alone. And really, this is one of those activities that get people out there, support one another in the Artist Cooperative. And it's not just the visual art, too. We've got a group of people that are now playing guitar together. And so we hope that we'll have some performances involving music, because this group is going really strong every week now also. So it's growing and getting bigger. And I really, really want to thank Bell for their opportunity to really expand what we can do, to have something to look forward to. You've seen the work today, and I think next year it'll be really exciting to see where we go from where we are today. So thank you very, very much. I want to say that we're going to advertise Bell on any of our production material. I also want to we're going to talk again at the Bell luncheon for the Chamber of Commerce. And we want to thank University Hospital Kingston Foundation and Providence Care for all their support. Thank you very much.
Thank you so much, Tracy and Adriana and Leah. Providence Care was founded by a remarkable group of women, the Sisters of Providence of St. Vincent de Paul. And they had as their vision at the outset to care for the most vulnerable in our society and to enable the best possible quality of life and independence amongst all residents of a community. And I just think there's a tremendous example in this particular program of how the Providence Care organization, by partnering with artists throughout the community, is achieving that vision. Our final speaker today is Mario Ruffalo, who is the Vice President of Patient Care and the Chief Nursing Executive at Providence Care, a role that he's had since 2009. Mario began his frontline nurse career in the intensive care unit at Kingston General Hospital. He has a bachelor's degree in psychology and a master's degree in public administration from Queen's. He joined Providence Care in 2006 as an administrative leader for complex continuing care and palliative care, following an 18-year career in clinical management positions at Anguinata Hospital. In his current role, Mario oversees professional practice, pharmacy, clinical support services, and provides operational leadership to all 6 patient and client care programs, which includes complex continuing care, specialized geriatrics, physical medicine and rehabilitation, geriatric psychiatry, adult treatment, and rehabilitation and forensic services. Mario?
Thank you. Try and speak so you understand everything I'm saying here. Thanks for the opportunity to speak with you today. I'm excited to be here. I've not been to a Bell Luncheon before. I've been invited a few times, but this is my first time here. Many of you, as Denise has described, already know what Providence Care does in the community, but also within our inpatient programs at the Mental Health Services site and our St. Mary's Lake site. And St. Mary's Lake site has been well known in the community for providing very, very high quality care throughout many different programs, which we just talked about. And those of you in the room who are from Kingston, I've always known St. Mary's Lake Hospital to be a site years ago where you kind of went in there, but sometimes you never came out. And it's one of those places where we did very, very good end-of-life care. And these days, we're actually known throughout the whole region, throughout the province, as a very, very, very active rehab facility. And that changed about a dozen years ago, that our relationship with the city became more of a rehab hospital, but also never losing touch of our role within complex care and our role within end-of-life care, and I'll talk about that in a minute. So the 6 programs Denise just mentioned are at St. Mary's and at the Mental Health Services site. We also have a long-term care facility, and we have over a dozen community programs that make up Providence Care. And you saw a couple examples today of one of the programs that really probably, I would imagine, very few of you knew that program actually existed within Providence Care. And many of us within Providence Care sometimes don't know all the programs and all the great work that happens. So I today learned a huge amount about this program, which I certainly knew a little bit about. I was well educated today in this program, and we'll continue to communicate the role of our community programs and the impact they have on thousands of people in our community. Not just the people in our beds, but the thousands of people we touch in the community programs. As many of you know, it's an exciting time for Providence Care. We're moving to a new site by 2016 is our date. And this is the first time the city will be able to see coming together of mental health services, mental health service programs, and the St. Mary's Lake Services programs. And people tell us, well, can that actually be done? Well, we're going to do it, and with the help of a lot of people within this community and a lot of patients and clients at the table, helping us to see how we're going to integrate mental health services and our complex care, palliative, and rehab programs under one site. Those of you in Kingston many years see the mental health services site as the old Kingston Psychiatric Hospital. People still talk about that. They drive by it, and I wonder what goes on in there. You know, that's sort of, and the old asylum used to be just down the road, the Penrose, which Anguinata was part of, which we eventually closed and moved all the clients to the community. So the history of that site is not necessarily positive history in light of many people within this community. But more and more people are driving in these days. They're not driving by. We have, you may know that we had the breast screening clinic needed a place to stay about a few years ago, and they actually moved onto our site for almost a year and a half, 2 years. And that meant the public came in onto that site like never before. They came in to have their breast screening exams done. They got in and out of a hospital that isn't locked up. It's actually, you can walk in the front doors of that hospital just like you can at St. Mary's or KGH. It's not a high secure zone where people should be afraid to walk in. We also have the Kingston General Hospital dialysis unit. One of their satellite units is actually now at the Mental Health Services site. It was an area that was redeveloped when we closed a number of wards. Again, more public coming in to that site that we've never seen before, and it takes away the stigma of what does a psychiatric hospital feel like? What's it look like? Well, it's bricks and mortars like everywhere else, and we need to we build a new one, but it also takes away the stigma of people coming onto that site where years ago they'd drive by. So it is an exciting time. We also, our staff are also in this, I'm talking to the public today, we're also talking to our staff around this. As we blend these two different cultures, the St. Mary's and Mental Health Services site, we do need to do quite a bit of work with our staff and our patients and our families to say that this is okay to do this, and here's how we're going to do it. Many of you probably know people that have been treated at the St. Mary's Lake site, either through someone recovering from a stroke, someone recovering from a hip and knee surgery, someone who spent some time in our palliative care unit or in complex care programs, or in the many outpatient clinics we have there. And many people that you know have could be your neighbor, your relative, or your friend that are St. Mary's, that have been to St. Mary's. Conversely, many people, many of you may not know anyone that's been to the mental health services site. And that's, again, not because your friends, your families, or your neighbors haven't necessarily been patients there or gone through the system there. It's just not talked about as much as someone who says, oh, I know Joe, he's actually had his knee replaced, he's at St. Mary's for a few weeks, he's going to be out and he's going to go therapy. Pretty well not sure that your neighbor will tell you that their daughter or their husband or their wife is actually spending 30 days with us at the mental health services site, going through intensive psychiatric care, rehabilitation care, through psychiatric programs. Not really talked about, and you may not ever know. So that's the change that I think is coming in the next generation. I think it's going to take another generation, and forums like this are actually going to be critical to open up that conversation. So this, it's a fairly small group of people, but I know you talk to many different people, so that's really the message that we want to send out. It is important for us to talk as a society about mental health in our community, because it affects many people. As Glenn said, 1 in 5 will be affected. It's absolutely true. People in this room are in that category. We're all in that category. But we don't talk about it enough, and I think someday we'll see in another generation or so where it's okay to be a patient getting treatment in a mental health facility or in clinics. And as the new hospital gets built, you're going to see people going in that front door, and you're not going to know whether they're in for a mental health clinic or they're for rehab or they're being admitted to another program. You're going to see blending of people like you would in a mall. People all walk through the mall, and you can't tell if they have a medical condition or if they've had a medical condition in the past or any kind of health condition. So that's our aim, is to build that community so that really when you walk through the doors, it doesn't matter who you are. We're trying to live our mission through that. Our St. Mary's Lake programs have enjoyed very, very generous donations through the foundation and through private donations, but all through the foundation. We've used those dollars to purchase very specialized rehabilitation equipment, specialized IV pumps, CAD pumps for our palliative care patients. We buy through donated funds the best possible beds and mattresses that we can afford to buy through that, and they're very state of the art. Our palliative program, if you want, I'll talk about that for a second. Pretty well all the equipment, the TVs we have in there, the furniture, the family room, the curtains, has all been done through donations through the foundation. And and we have 10 active beds right now, so it's not an easy task to keep those rooms going in terms of keeping them updated. But really, we've enjoyed a great benefit from the donations to fund those rooms. And people appreciate families when they see places where families can sleep, where they have access to telephones, TVs, cable, telephones, all at no expense to the patient and the family while they're there, often for a very few short days. And recently we've seen an increase in recognition of donors acknowledging the care they receive at the mental health services site. So that's a new trend we're seeing, where people are now saying, you know what, I want to put maybe in the paper that I want to thank the geriatric program or the adult treatment program or another program we have about the care they receive at the mental health services site, and people are actually donating and making it more of a public, not that many, but a few are making more of a public announcement. This is where they'd like their money to go to for these reasons. And we had a substantial donation just last year where we're on our geriatric psychiatry program, where we're actually creating now an end-of-life palliative care room within our geriatric psychiatry program. And we believe, and we have a number of people that pass away in that program, we believe they also need the best possible environment, equipment, and setting if they're going to spend their final days with us in a different setting than our normal palliative care unit. The program also, again, through donations and through other capital realignment within our hospital, the mental health services program, and I'll use our psychiatry patients for now. We've been purchasing, again, state-of-the-art beds, mattresses, and equipment for that group, for that population of patients. We have patients fall. There's always fall risks, especially at nighttime. People are wandering on some of these units. These beds, if some of you have seen them or not seen them, have alarms on them. They're exit alarm systems. They alarm when someone actually turns around in bed. They alert the nursing staff. There's little lights that come underneath so people can see them, that light up the way. Their special beds are very low. They go as far low to the ground as possible. So even if someone does step out, walk off, they're not going to hurt themselves if they're going to fall down. So those are the investments we're making with equipment that we're purchasing, many of which are donated through donated dollars. So we have to reduce the falls, risk of falls to all of our patients, and having the proper equipment and supervision is one of the roles we do that. We track many quality indicators within our facility, and some of the most important indicators we pay very close attention to are what our patients, our clients, our residents, and our families are telling us, and that's through patient and family satisfaction surveys. We do those every couple of years. They're done independently of Providence Care. And I can report to you that our programs are still some of the highest rated programs in the province of Ontario. Some programs actually achieve 100% satisfaction, which is, I don't know how, but that's what patients are telling us, so that's a good thing. But in some programs, mental health recently has been surveyed. Again, in 2007 we were surveyed, in 2011 we got surveyed again, and we're seeing a lovely increase in the satisfaction level in the care we're receiving there, care that patients are receiving there. So we've achieved these high scores of patient satisfaction. Again, it's a point in time. It's the patient, the family's perception of the care they receive that day where they're doing their survey. But we've actually been able to sustain that work, those type of levels of satisfaction. Where other hospitals are calling us, asking us, how are you actually doing that or achieving that and sustaining that? And we're happy to share that because it's actually a good news story. You know, I'd like you to believe that the board and the administration can take credit for that, but actually the real credit belongs to the frontline staff, the volunteers, the physicians, our board members and others as well, but what happens at the bedside, what happens in the community, what happens in the clinic is actually what matters, and that's what people report to us. They don't talk about maybe decisions I made at a senior team table. They talk about how they felt when they were treated while they're a patient or a family under our care. So it's a privilege for me to work for organizations such as Providence Care. In times of never-ending change and fiscal constraints, we have never lost sight, and we'll continue not to lose sight of our mission, vision, and values, which certainly came from the sisters many years ago. And we aim to treat everyone with respect, dignity, and compassion. It's what all of us should expect whenever we get touched by the health system. That's something that Providence Care thinks highly about, and what we continue to do on a daily basis. Thank you.
Thank you, Mario. So we've talked a lot about things that are going on at Providence Care, and it's a very, very exciting place to be affiliated with these days. Just to reiterate something that Mario mentioned very briefly, Infrastructure Ontario has announced 3 consortia that were named as pre-qualified to be considered for the construction of the new Providence Care Hospital. We expect that request for proposals will be issued before the end of the calendar year, and that we will be right on track to have those doors open in 2016, and looking forward to that very, very much. I know that many in the room supported all 3 of our hospitals with campaign gifts, so you will likely know at this point that all of the new areas of KGH are open and functioning and being used with much appreciation by patients in many areas. Our Hotel Dieu expanded ambulatory care clinics. The transfer of clinics from KGH over to Hotel Dieu will be taking place later this year. So that'll be two of our 3 MATSLIP projects done, and a third one on the horizon to be complete. And in this year that we're in now, we are soliciting support to replace beds, mattresses, lifts, and specialized equipment for patient care at Providence Care, as well as for an expanded ophthalmology clinic at Hotel Dieu and a clinical investigation unit at KGH. So we would thank you for all your past support and hope that one or more of those projects will encourage you to continue supporting us in the months ahead. Just as I close off, I wanted to just comment on the fact that although the words that we heard today were inspiring and educational and informative, I found that the images that we looked at while our speakers were talking were just phenomenal. They were so full of joy and light and color and hope and optimism. And to think about those coming out of a program that cares for people who are really having a rough time with a health issue is just quite phenomenal. And so as I send you on your way into this beautiful, beautiful day, I just wanted to close with a quote that I saw up here on our screen from artist Brian Proul, who had a significant role in creating this Artisans program, and it's this: there is an incredible amount of beauty in everyone. Go and enjoy the beauty. Have a nice day.